Ladies and gentlemen, please welcome the 16th President of the George Washington University, Dr. Stephen Knapp.
Good afternoon. I truly am delighted to welcome you to the installation of Dr. Lynn Goldman as the inaugural Michael and Lori Milken Dean of the Milken Institute School of Public Health. We are fortunate to have Mike and Lori with us today, as well as Dean Goldman's husband, Doug, and also members of her family. And I have a list of people I'd like to recognize. Special welcome I'd like to extend to His Excellency Youssef Al Otaiba, Ambassador of the United Arab Emirates, to Dr. LaQuandra Nesbitt, Director of the Department of Health of the District of Columbia, to Dr. Linda Birnbaum, Director of the National Institute of Environmental Health Sciences, to Michael Clouden, President and CEO of the Milken Institute, Dr. Richard Southby, Dean Emeritus of the Milken Institute School of Public Health, and his wife, Dr. Janet Southby, Dr. Victor Dzau, President of the Institute of Medicine of the National Academies of Sciences, Ed Greising, Senior Vice President for U.S. Corporate Affairs and Global Services for Sanofi. Ed is also the Making History Campaign co-chair for the Milken Institute School of Public Health. Angela Moscow, Vice President for Chronic Disease Prevention and Wellness at Sanofi US. Fred Brown, Chairman of Fred L. Brown Associates, and along with Ed Greising, the Making History Campaign co-chair for the school. Rear Admiral Kenneth Moritsugu, former Acting Surgeon General of the United States and Vice Chair of the Milken Institute School of Public Health Dean Council. Nelson Carbonell, Chair of the George Washington University Board of Trustees, and George Washington Trustees, Vice Presidents, and Deans who are also present. And finally, members of the Milken Institute School of Public Health Deans Council. We're very delighted to have you all here to join us in celebrating this very important milestone in the history of the university and certainly of its one of its newest and schools of which we're most proud. Endowed positions like the one we're celebrating this afternoon serve the university's mission of teaching, research, and service in a uniquely powerful way. They enable a university to attract and to retain the distinguished teachers, researchers, and academic leaders who both ensure its ongoing excellence and chart the future of its growth. Today's ceremony carries on a tradition that began nearly 500 years ago when Lady Margaret, the Countess of Richmond and mother of King Henry VII, endowed chaired professorships in divinity at the universities of Oxford and Cambridge. In 1546, Henry VIII established the Regius professorships at the same two universities and in 5 subjects: divinity, civil law, Hebrew, Greek, and physics, the last of those corresponding to what we now know as the fields of medicine and health. Later, private individuals joined in endowing professorships, such as the Lucasian Chair in Mathematics, which Isaac Newton assumed in 1669. The oldest endowed professorship at the George Washington University, the Congressional Professorship, dates back to 1832, when it was created by an act of the United States Congress. The second oldest professorship, the Elton Professor of Mental and Moral Philosophy, was an 1872 bequest by Romeo Elton of Exeter, England. This afternoon, we are delighted to continue this tradition and to do so with the installation of Dean Lynn Goldman as the inaugural Michael and Lori Milken Dean of the Milken Institute School of Public Health. And in this position, she will hold only the second endowed deanship in the history of George Washington. Dr. Goldman is a renowned educator and physician whose wisdom, experience, and expertise helped to make her an outstanding leader. She earned her Bachelor of Science degree in Conservation and Natural Resources at the University of California, Berkeley. She then went on to earn a master's degree in Health and Medical Sciences, also at the University of California, Berkeley, and then a medical degree from the University of California, San Francisco, and finally a master's degree in public health at what is now the Johns Hopkins University's Bloomberg School of Bloomberg School of Public Health, formerly the School of Hygiene and Public Health, which is what it was called when she received her degree. Dr. Goldman began her professional career at the California Department of Public Health Services. There, among her other responsibilities, she managed a statewide environmental epidemiology program that focused on childhood lead poisoning, birth defects, and occupational health. In 1993, President Clinton appointed her Assistant Administrator for Toxic Substances at the U.S. Environmental Protection Agency, a position which she held for 5 years. And then in 1998, Dr. Goldman joined the faculty of Johns Hopkins as a professor of environmental health sciences. In that capacity, she served as principal investigator of the National Children's Studies Center at Johns Hopkins. Dr. Goldman was named Dean of the George Washington University School of Public Health and Health Services in 2010. Under her tenure, the school has truly come into its own. Now, in its 18th year, it is recognized as one of the nation's premier schools of public health. Dr. Goldman's leadership led last year to the historic announcement of a combined $80 million gift for the Milken Institute, the Milken Family Foundation, and the Sumner and Redstone Foundation. And that generous gift will ensure that the school will continue to rise in stature and fully realize its mission of advancing public health both nationally and globally. And I should add that in addition to leading the school academically, I think you can see that she's done a certain amount in leading the improvement of its infrastructure, given this extraordinary facility that surrounds us. Dr. Goldman serves on the Board of Trustees of the Environmental Defense Fund. She is a member of the Institute of Medicine of the National Academies of Sciences. She serves on the Institute's council, as well as on the Academy's Board on Environmental Studies and Toxicology. All of us at George Washington are proud that the leader of our rapidly growing School of Public Health is now the Michael and Lori Milken Dean, and we are very fortunate to have such an accomplished physician, scientist, and health advocate as the deanship's inaugural occupant. And it's now my pleasure to invite Dr. Steve Lerman, Provost and Executive Vice President for Academic Affairs, to say a few words.
I thought I'd say a few words about Michael and Lori Milken, Dean of the Milken Institute of Public Health Fund, which takes a while to say, but it's worth every word because it is important. It was established, of course, by the Milken Family Foundation to support the leadership activities of the Dean of the School of Public Health here at George Washington University. And the resources it provides are focused on creating new scholarships and fellowships for talented students who are actively pursuing advances in the field of public health. I can think of no more useful and important investment in the future than to invest in our students. I'm delighted to join you this afternoon to install Dr. Lynn Goldman as the inaugural Michael and Lori Milken Dean of the Milken Institute School of Public Health. And I'd like to first recognize Mike and Lori for their generous gift, and of course in a few minutes after I introduce him more formally, we'll hear a few words from Mike himself. It's not easy to introduce someone who has had as much success in so many areas as Mike Milken. He's been one of the world's true innovators, both as a philanthropist and as a financier since the 1970s. Others have tried to describe him in many ways. Esquire magazine called him, and I'll quote, one of the most influential people of the 21st century. As a financier, Michael revolutionized capital markets by expanding access to funding for thousands of companies that in turn created millions of jobs, many of which, of course, still exist today. As those companies have grown over time, they have expanded their role in the U.S. economy and abroad in ways that have benefited these millions of people and all the people that are affected by them. The Washington Post said, and again I'll quote, "Milken helped create the conditions for America's explosion of wealth and creativity." Again, pretty high praise from a publication not used to praising people very much around Washington. He began on Wall Street in 1969, and his philanthropy soon followed, paralleling his business career and expanding in 1982 with the establishment of his family foundation. He's been at the forefront of many initiatives in medical research, education, and public health. Fortune magazine called him, and again I'll quote, "the man who changed medicine." And just last month, he was on the cover of Forbes magazine over a headline that read, "Visionaries Reimagining Our Children's Future." So with that just short synopsis of the accomplishments of an incredible individual, I'm now pleased to invite Mike and Lori Milken, President Knapp, Chair Nelson Carbonell, and Dean Goldman to join me on the stage, and we'll present a gift to Mike and Lori for their generous support of the university and, of course, the school that bears their name.
Well, first, President Knapp, thank you for joining us and inviting us to be with you today. We are honored to be with you, your wife, your family, whether it's on the West Coast, East Coast, Europe, Asia, etc. We spent time together. And second, I have to first praise my wife, Lori, for inspiration, raising our family, and particularly serving as the nanny for 9 of our grandchildren. The opportunities that I saw in this young girl that I met in 7th grade continue, and I was a bright student and recognized when I saw in our high school graduation that she was voted the most likely to succeed. I wanted to get as close to her. At first I was a little confused and talked to Lori when I heard that Dr. Lynn Goldman was going to be installed. Surely they must have used the wrong verb. I said, Lynn is many, many things, but she's not an appliance. But President Knapp assured me that this was a venerable, as he's pointed out, academic tradition going back centuries. So what terminology we are thrilled to accept here that relates to Lynn? To lead the Milken Institute School of Public Health. Congratulations, Lynn, and thank you for all you do. Next, I've been very focused on the school, Lori and I, and public health for much of our lives. In 1972, Lori's mother was diagnosed with breast cancer, a disease she successfully battled for more than a decade, only to succumb to multiple myeloma 12 years later. A few years later, my father was diagnosed with melanoma. I visited more than 20 cancer centers around the country with him, and eventually they told us, and eventually I concluded the same thing, that science could not be moved fast enough to save my father's life. And I learned the lesson of what a real problem was, is something that could not be solved with money. Over the decades, Lori and I have lost many close family members, as most of the people in the United States have, to cancer. Most recently, our sister-in-law just a few months ago. Our interest in public health, however, predates our interest in focus on cancer research. For those that remember the 1950s, and was brought back vividly to me when President Knapp, when Dean Goldman and others from GW visited the first opening ever of the Center for Disease Control earlier this year. In the 1950s, polio was not an obscure problem in developing countries, but a major threat to the United States. Parents were told they should not let their children mix with different groups of kids, not to let them get too overheated or too cold, not to use public swimming pools. Kids were told the same thing. No one was immune from the risk of polio. Economists predicted that by the year 2000, hundreds of billions of dollars would be spent dealing with polio. And in the 1950s, plans began to build iron lung hotels to hold the patients. There at the CDC, we saw these rooms, these large football rooms, pictures of them in the 1950s with iron lungs holding people. And we had an opportunity to watch a video of a gentleman who lived 10 years in an iron lung. It was astounding when I think back of that day, and my father had polio as a child, and his limp was a constant reminder to me of that time. It is difficult to appreciate today the level of concern for polio in the 1950s. It was declared an epidemic. But a couple years later, Dzau, in addition to others, most particularly Albert Sabin, removed this disease from the eyes of the world. It was only a few years before we had the maximum number of people in the United States diagnosed with polio, 40,000. However, the public was concerned about taking this vaccine, much the same we hear today about vaccines that are available. And you only have to go to Disneyland now, unfortunately, to get the measles. So they went to find a person to lead public health in the 1950s. This one was not a public health pioneer, but when he received his shot on national television, calming a nervous public, Elvis Presley entered the public health hall of fame. The greatest scientific breakthroughs are only effective if we actually implement them and use them. We are reminded today when we see headlines around the world of diseases re-emerging as parents or other events cause the lack of vaccination of children. When Elvis got his shot in 1954, those 40,000 recent cases were affected. 3 years later, we were down to 5,000 cases from 40,000 in America. And by 1963, for the most part, polio was eliminated in America. We saw a similar threat 30 years later as Oprah Winfrey warned her audience in the late 1980s that 1 in 5 heterosexuals would be dead from AIDS by 1990. 1 in 5 in America on television. A few years ago, we were honored at the Celebration of Science here at George Washington University to hear from Magic Johnson, who for many became the face of AIDS to the world. Bigger in life figure with a smile as wide as this room. Alive and well 20 years later. Public health programs have worked, have contained AIDS, and we are on the verge, as we celebrated at the Celebration of Science on this campus just a few years ago, to making AIDS a chronic disease, not a life-threatening disease for the world. Last January, as Dr. Goldman and President Knapp and others from GW went to the CDC, we got a chance to focus on the potential for public health in the world today as we know it. This was right before the outbreak of Ebola. And shortly thereafter, as we returned, we spent the latter part of January, February, and the rest of the months of the first and part of the second quarter focused on these issues. And with Tom Frieden at the CDC and with the leadership here from GW, wondering when we could just turn this problem over to experts who already knew what the solutions were and take it out of the political realm into the scientific realm. The promise of public health is significant. Today in America, 70% of all healthcare spending is related just to lifestyle decisions, 70%. We have learned more and more that we can't blame our parents or our ancestors for our disease because most of the people, by the way they've chosen to live their life, have dramatically changed the probability that they will suffer life-threatening diseases. We estimated a number of years ago in a report of an unhealthy America that the cost to America was $1 trillion a year, just the change in average weight between 1990 and 2007. We chose to come here to George Washington University for the leadership of President Knapp, for the leadership of Dean Goldman, the quality of the faculty, but also that it has the potential to shine the brightest light in the world on these issues. With the decision makers within a half a mile of where we sit today, we believe our partnership with George Washington University can change these priorities and change the world, not just for the United States, but for the world itself. It takes leadership to make these things happen, and we couldn't be happier with the leadership of the Milken Institute School of Public Health and of George Washington University. Thank you for joining us.
Please welcome to us, Lerman.
It's now my privilege and honor to introduce our next speaker. Dr. Victor Dzau was elected as the 8th president of the Institute of Medicine of the National Academy of Sciences on July 1st, 2014. As president, he has worked to advance the Institute's mission of advising policymakers and health professionals on the world's most pressing health problems. Before his appointment at the IOM, Dr. Dzau served as Chancellor and James E. Duke Professor of Medicine at Duke University, and as the President and CEO of the Duke University Health System. Dr. Dzau has long advocated for the expansion of translational research and healthcare innovation. While he was at Duke, he established the Duke Transitional Medicine Institute, the Duke Global Health Institute, and the Duke Institute for Health Innovation. He's been a pioneer in the field of cardiovascular medicine and genetics. His research has led to a fuller understanding of vascular disease and how it can best be treated. Dr. Dzau serves as a member of the board of directors of the Singapore Health System and the International Advisory Board of the Biomedical Science Council of Singapore, and as chair of the International Partnership for Innovative Healthcare Delivery Board of Directors. He's received numerous honors for this work, including the Distinguished Scientist Award from the American Heart Association and the Public Service Medal from the President of Singapore. Dr. Dzau was elected to the Institute of Medicine in 1998 and has fostered a decades-long working relationship with Dean Goldman, based on their shared commitment to innovation and the whole field of public health. In 2009, they had the distinction of planning the first IOM annual meeting on the topic of environmental health. Ladies and gentlemen, please join me in welcoming Dr. Victor Dzau.
Good afternoon. President Knapp, Provost Lerman, Mr. and Mrs. Milken, Dean Goldman, distinguished faculty, and guests. So it's a great pleasure for me to be here today. You know, the GW University and also the Milken Institute of School of Public Health have done so much to advance health research and train top public health professionals. So for me, it's a great honor to be here. To say a few words, particularly about my good friend, Dr. Lynn Goldman. I want to congratulate you for being installed as the Michael and Lauren Milken Dean of the Milken Institute of School of Public Health. I said it right. So now Lynn, as you heard, has held really high positions at EPA, the California Department of Health Services, the Johns Hopkins Bloomberg School of Public Health, and really she's used all these opportunities to advance the field of environmental and childhood health. She is one of the most distinguished academics in the field of health policy. As you heard, she led the National Children's Study at Hopkins and many other important studies. She's received numerous awards and honors from university, government agencies, and professional societies. In 2009, she was named as one of Maryland's top 100 women by the Daily Record, and she won the Heinz Environment Award in 2010. So you can see she's done really a huge amount for the public and for its health. My feeling is that many people are intimidated by the complexity of science, medicine, and policy, but Lynn is one of those who mastered all these three and devoted her life to using them for the good of humankind. So I think we're incredibly lucky and fortunate to have people like Lynn, who uses her position and her platform to further interest of those who don't have a big voice. For example, she uses her research to inform how we protect our children from environmental hazards that are often invisible and thus become stealth killers of those who don't look for them. And she uses her policy expertise to move us towards toxin regulations that are fair and safe for everyone, not just for those who are fortunate enough to live in the cleanest and healthiest neighborhoods. Now, I have the great pleasure of working with Lynn. You heard at the IOM, my first encounter with Lynn was the 2009 meeting that we put together in health and environment. I was saying earlier that we actually got, I think it was Judy Woodruff, Hans Sores, and others. It was too glitzy for IOM. But we changed the way IOM did the meetings because we thought it was needed that we have a lot more engagement rather than lectures, discussion. And this was, to me, a seminal meeting that we put together. And it was my great pleasure to do it with you, Lynn. But you know, at the IOM, we look at her as a leader, listener, and collaborator, and she contributes to Institute of Medicine in so many different ways. In terms of our work to improve health, she's been involved with Roundtable on Environmental Health Sciences, Research and Medicine. As you heard, she recently led a very important workshop, in fact, on priorities to inform public and health practices for Ebola. So we lean towards Lynn frequently to ask her for advice and to lead some of these very important initiatives. She shaped our organization tremendously. As you heard, she is in fact elected to a member of the Institute of Medicine Council, which is equivalent to the board of directors. So in some way, Lynn's my boss. And she advises me frequently on so many issues. And perhaps importantly, the most recent contribution is she led the review of the Institute of Medicine, the external committee to look at our 3-year performance. I think the report's going to be okay. But if not, I know that Lynn will help us to make a much better organization. Now, when I put this remarks together, my special assistant wrote up all the things she was doing. I said, boy, that's a lot of IOM. Can we compress 4 paragraphs to 2? I just did. But you know, I just want to point out to you how important she is, in fact, to the nation, to the Institute of Medicine, because our job is to serve the nation, to advise the nation on issues of health, and Lynn certainly is one of the key leaders, certainly in our institution, and also for GW, of course, for nationally. So it's really great when I think about all those things to see that she's installed as Michael and Lori Milken Dean, and she's made a big difference. So I think the Milken should be commended for the vision and generosity. I thought your speech was fabulous. I think it was passionate, clear to the point, and you have done so much, both of you, to touch so many aspects of our society, contributing to improvement in medical research, schools, youth development, and of course public health. You have foresight in investing in Lynn, I can tell you, and her institution, because your support, I know she and GW will make this the world's very best public health institution. And I want to congratulate Lynn again, and I look forward to all those things you continue to bring to our field in the forthcoming years. Thank you very much.
Thank you, Dr. Dzau, for those very eloquent words. And let me join Dr. Dzau, Mike, in thanking you both for that passionate and eloquent speech, but also much more broadly for the partnership, which I think is really transformational for our university across a range of our endeavors. And your leadership in the field of medicine and health, I think, is unparalleled for our nation, and we're very proud to an honor to be able to have that partnership. And it is now my honor to perform the actual installation of one of our brightest and most effective pieces of hardware, I think is. And so, if I may ask the metal party to join me once again at the front of the room. I will confer the medal. Ladies and gentlemen, I give you the Michael and Lori Milken Dean of Public Health.
Wow. Good afternoon. I'm truly honored to be here with you today. Thanks to President Knapp, to Provost Lerman, and especially to Mike and Lori Milken, and of course Sumner and Redstone. Without their vision and generosity, this moment in the history of our school would not be happening. I especially thank the Milkens for their understanding the critical importance of leadership as shown by their establishing the Michael and Lori Milken Dean. And together with the vision, values, and commitment of the leadership of the George Washington University, this incredible institution is fully and visibly committed to public health. There is no doubt that this school is on the rise. This year, we admitted our best students ever, some of whom are here today. In the last 4 years, we have recruited dozens of new faculty who are moving us forward in excellence in teaching, in research, and public health policy. With our location in Washington, D.C., we are at the center of policy changes that are transforming health and healthcare at a breathtaking pace. We are a stone's throw from the international agencies responsible for global health, federal health and public health agencies, the NIH, health NGOs, and the health department for the District of Columbia. What we fundamentally care about is the generation of knowledge and its application to making the world a healthier place for all of us, whether in fighting Ebola virus, bending the curve for the obesity epidemic, ending smoking, preventing spread of HIV, cleaning up air and water, assuring access to treatments and preventive care, fighting antibiotic-resistant bacteria, building healthier environments for our children and the elderly, and yes, of course, preventing cancer and chronic diseases. And our location allows us to be engaged at this work at all levels. We are proud to train students who are here not only to learn the science of public health, but also to learn how to apply that science to the practice of public health in the real world. Students who care about making this world a better place to live for all of us. I'm lucky to have wonderful students, but also wonderful faculty. Witness in recent weeks with the Ebola virus epidemic and the incredible response from our school in this field and in policy by faculty like Ron Waldman, Rebecca Katz, Julie Fisher, Lonnie Simonson, Amira Rose, Fitzhugh Mullen, Sebley Freywatt, just to name a few. I must recognize the faculty, students, staff, and alumni who make this School of Public Health what it is. I want to thank them for their commitment and dedication to making the world a healthier place. I would also like to recognize the members of my family who are here with us. My brother and friend, David Goldman, and his wife. My cousin, Stephen Goldman, all the way from California. My husband, Doug, my best friend. And my father, who wanted to be here but couldn't make the trip. Someone who couldn't be with us today in body but is in spirit is my mother. When I accepted this job in 2010, puzzled, Mom asked me, "Lynn, what does a dean do?" I responded, "All the things you taught me to do." I meant this response to be funny, but in many ways it is true. I've been fortunate to have a mother and a father who valued my intelligence and perspectives and who never erected a glass ceiling over my head. According to Dad, Mom used to say, "Never give up on Lynn." You can take that several ways. But Mom, a nurse, above all valued life. Any small animal, whether a kitten, a wild baby bird, a day-old rabbit that the dog brought in, or even a child, would receive her utmost attention. Above all, she taught me about the value of caring and responsibility. Admittedly, being a dean is not as hard as taking care of wild baby birds. But it does involve a lot of caring and feeding. As the Michael and Lori Milken Dean of this school, I do hardly any of the important things that happen in this building. But I do have the privilege of leading a wonderful faculty and staff who do all of those things every day. And resources help. How? Well, to support scholarships, to recruit the best students, to provide startup funding for faculty research, to recruit the best faculty in the country, to establish top-notch research centers like the Sumner and Redstone Global Center for Prevention and Wellness, to build state-of-the-art facilities for research and teaching. We have begun to do all of those things, and we need to continue on that path. I want to fund new centers for global health, for prevention of antibiotic resistance, for healthy aging, for policy research, for promotion of the health of people right here in the District of Columbia. So while we have come a long way, we are only at the beginning of the process. One thing that I have in common with Mike and Lori is that we both spent some of our formative years in Berkeley. In my case, as an undergraduate, I had become a volunteer at the Berkeley Free Clinic, helping people who called or came in with a crisis. Jobs at the clinic were filled via election, and I was voted to be the clinic administrator, quite a responsibility for a 21-year-old who had not graduated college. In fact, I had taken off a year from college after realizing that while I really loved taking math courses, I wasn't going to be a mathematician when I grew up. And I didn't know what I was going to do. So this was quite a gap year for me, learning how to manage a large volunteer network, writing grants, participating in a county-wide community clinics consortium, and leading what felt like endless administrative meetings, perhaps a good training for a dean. Here again, I was lucky. The owner of a local bookstore, Pat Cody, was our treasurer, and she taught me how to make payroll, balance the books, and write budgets. A DES mother, she also was a public health activist. It sparked my interest in prevention of birth defects and cancer. Ironically, it was at the Free Clinic that I became interested in public health. As much as I loved helping individuals, I felt frustrated by patching people up and then sending them back out into the environments that were making them sick in the first place. I realized that my true passion would be to go as far upstream as possible to prevent the conditions that were causing ill health. So I went to UC Berkeley to study environmental health. I went to Hopkins to get an MPH, UC San Francisco for medicine, and Children's Oakland for a residency in pediatrics. At Berkeley, I became even more involved with environmental health when I learned about the Cancer Mortality Atlas that recently had been published by the National Cancer Institute. Interesting to me, some of the highest rates of cancers like bladder cancer, leukemia, and lung cancer were concentrated in areas like the Texas Gulf Coast, where I grew up, reinforcing my interest in environmental health and prevention. I'm sure this is what led to my eventually working in public health as an environmental epidemiologist for the state of California, and later in a policy position regulating pesticides and toxic substances at the US EPA. Tragically, many years later, my youngest brother died of bladder cancer. As an epidemiologist, I know that we will never know what caused his illness. But as a public health professional, I know we must continue to fight to prevent cancer, whether by stopping exposure to smoking and secondhand smoke, or reducing levels of harmful pollution in our air, food, and water. I must have internalized my mother's message, never give up on Lynn, because along the way there were many who doubted the course that I was taking. For example, at the Harvard School of Medicine, there was an interviewer who told me there was no such thing as the career I told him I wanted to pursue. Well, I never did go to Harvard for medical school, but I did pursue that career. From this experience, I learned to listen to younger people and to be open to new ideas. One of the most exciting things about my life is the privilege of interacting with faculty and students, my colleagues at GW. Looking around here today, I do not sense the ghosts of the past that haunt many academic institutions. What I do sense is a very high level of energy in this wonderful building, the passion for public health among our students, faculty, and staff, the opportunity to bring people together, enormous intelligence to commit to the transformational public health work in which we're engaged. This is work that is vital to the health and wealth of our global community. And there isn't a better place to do this work today than the George Washington University. I'm proud of the goals of the school. We advance excellence in scholarship, advance the health of populations in local, national, and global communities. We incorporate our core values of scholarship, leadership, scientific rigor, and policy analysis into our educational programs. And we foster the development of the next generation of public health leaders. I'm thrilled to be part of the GW strategic initiatives to advance interdisciplinary scholarship in policy and governance, globalization, and citizenship and leadership. To add to my good fortune, life has brought me a wonderful team at GW with whom to work under the leadership of a visionary and energetic university president, Steve Knapp, and a wise and wonderful provost, Steve Lerman. This campus provides unparalleled opportunities for our school, not only because of its location, but also because we have wonderful colleagues in the other schools: medicine, nursing, law, international affairs, business, arts and sciences, engineering, education, and professional studies. And I've seen representatives from all of you in the room, and our relationships with you are incredibly valuable. But now I am truly honored to be installed as the first Michael and Lori Milken Dean. Mike and Lori, you have challenged us to take this school to the next level. We will. Thank you.
My privilege actually to say a few closing remarks, and then of course I'm going to invite all of you to the reception for Dean Goldman and of course all our distinguished guests. These ceremonial events, I think, are things that bind the community together around our shared and common vision, but they also give us an opportunity to really recognize outstanding individuals like Dean Goldman and those who are incredibly supportive of the overall mission of the university and the school, in this case the Milkens. These activities, resonate, and they sort of fulfill our highest aspirations for what we as academics want to happen. Ultimately, these things, these gifts, go on for generations. And as the first recipient of the Lori and Michael Milken chair, she's going to start a chain that will go on forever. We look back, President Knapp mentioned the Lucasian professorship. If you sort of go through the list, if you ever do it, of who actually held that, it's extraordinary. And so endowed chairs and these installation activities really do represent, probably in many ways, the best of us and what we want to accomplish as academics and the resources needed to do it. So I'd like to thank all of you for taking time out of your busy day to come here and invite you to join all of us at the reception. Thank you for being here.